Hi there, Dr. Caudill here. I'm going to be talking with you all today about a topic that's kind of a tough one, and that is namely, how do we talk to our kids after we've been given a cancer diagnosis? I wrote about this recently on a blog, which you can find on my website, which is theparentdoctor.com. And I wrote this blog and I'm making this video in response to a request from one of my colleagues who is a psychiatrist who treats adults with new cancer diagnoses. And we were discussing how difficult that is, especially when the person being diagnosed with cancer has kids of their own. I think cancer is always a tough diagnosis to handle, but especially if you have dependent children, your thoughts, of course, are going to go to them and your worries to them. And when you're overwhelmed with all that you're processing with a new diagnosis, it can be really hard to know how to broach this subject, what to say, what not to say. And so I think it's helpful, hopefully, for me to give some guidance and to give my thoughts about this. I would encourage you, if you've stumbled upon this video through a search, to check out the blog post, because at the start of that, I discussed some important issues with regards to how a cancer diagnosis affects our own sympathetic nervous system activation. Of course, a cancer diagnosis feels threatening and scary, and naturally that's going to evoke a response in our bodies. And it's going to trigger that sympathetic nervous system activation, which is that fight, flight, or freeze reaction in ourselves. And we really have to work on understanding that and sort of tempering that before we should even start a conversation with our kids about this diagnosis and what it's going to mean for our family. I'm going to discuss these approaches in three different categories. So first will be if you have really young kids, like preschool age kids. The second will be if your kids are sort of school age, elementary, maybe early middle school. And then the third will be for older children who are maybe teenagers or pre-teenagers who can really kind of understand what cancer is and have an adult-sized conversation about it. So let's start with if your children are very young. One thing I think many parents don't appreciate is that even kids who aren't yet very verbal, they will understand a lot of what you say. Think back, if you've ever yourself studied a new language, you probably can relate to this yourself, right? You know, after a couple of years of studying a new language, you might be able to speak like a 4 or 5-year-old person of origin in that country, but your understanding might be a lot better. Same is true for our children. And one mistake I've seen my own friends make is talking about their cancer diagnosis or other medical issues right in front of their kids. And even if the kids can't totally understand the words that are being said, they will understand your tone of voice, whether you seem afraid. They'll understand your friend's response to you. So be mindful about discussing this, phone calls you might have in the presence of your young kids, and discussions you might have with friends in front of your kids. Just understand that they're going to know more than you think that they do. That said, when you talk to them directly about what you're going through, it's going to be important to use language that they can understand. So you're going to want to talk maybe about, mom or dad, I might have an owie, I'm going to go see a doctor. And when I come back, I might be kind of tired, or I might feel a little bit sick. I might need to take a nap. Those are words that they should be able to understand because they've probably been sick at some point. They've had an owie at some point. They've been tired and needed to take a nap at some point. If you are going to need to have any kind of a surgery or procedure, you may want to show them and preview with them on a stuffed animal or a doll what it's going to look like. If you're going to have a boo-boo, if there's going to be a bandage, if there's anything that they might visibly see on your body, preview that with them and show them and kind of care for the doll or the lovey in the same way that you want them to care for you. And if it's going to affect how you're able to interact with them, for example, if you won't be able to lift them or hug them, or if you're going to need some special assistance, talk with them about that too. The more that we can preview with our kids how our diagnosis and treatment might impact them and the things that they're going to see in terms of changes in our bodies, the less scary it will be for them. Now, if we're talking about school-age children, we need to keep in mind that they're going to have heard about cancer, probably. They're going to understand that word. Preschool-age children are not going to understand that word, so I don't recommend even using the word cancer with them. You may not even, especially a young child, 1 or 2 years old, you're not going to even probably talk to them about this as being sick, but you might want to tell them the day before or the day of a procedure what's going to happen so that they kind of know what to expect. And again, previewing as much in advance as possible any new caregivers who are going to be entering their lives or any changes in their routines will be very important. For school-age children, on the other hand, you probably want to wait again until you've had time to process this diagnosis yourself, until you can talk with them about it and feel calm and confident about the conversation. And the first conversation should probably be pretty brief, and anticipate that they may have some scary questions for you. They might just blurt out the first thing that comes to their mind. If they've heard of cancer, they may have heard of it in a worst case outcome kind of situation. And they might say something like, "Are you going to die, Dad? Does this mean you're going to die, Mom?" So don't be caught off guard by those raw questions that school-age children tend to ask. They don't have the same filters in place that adults do. And if it's on their mind, it might just come out their mouth. So it's important that you be in a place where you can be ready to calmly respond to such questions. And honestly, you don't want to deny the possibility of some bad outcome. You want to reassure them that you're going to do everything you can. You want to let them know that you will die someday, because we all will. We don't want to tell them, "No, I'm never going to die," because it's not true. But you can say, "We all die someday. So yes, I will die someday. But right now, I'm getting treatment. I have a great team of doctors and nurses who are taking care of me, and I hope to be around for a long, long time," because that's the truth, right? And then you can reflect with them as time goes on in future conversations. They might express the difficulty of holding on to that uncertainty, and the feelings of fear and feeling scared that they might have. And it's okay to normalize that for them, and to let them know that, yeah, uncertainty is really, really hard, and that you feel scared sometimes too, but that we can do hard things, and let them know that you're going to get through this. For school-age kids, you can tell them that you are being treated for cancer. You can let them know what the treatment is going to entail, whether it's going to entail a surgery or medications or chemotherapy. You can let them know, again, not in extreme medical terms. You're not going to want to tell them it's stage 3 and this many lymph nodes are affected or something like that. They don't need to know all those kinds of details. But you can just tell them kind of, this is what's going to happen. This is how long the treatment will last for. This is what it might affect me as, I might lose my hair, or I might be tired after the treatments, and it's going to be for this many weeks. And just let them know if they have any questions about it, they can talk to you about it. And let them know that even though you might look tired or sick sometimes, it's not contagious and they can't catch it from you. And talk about how you like to take care of them when they're sick. What do they like when they're sick? How do they enjoy receiving love from you when they're sick? And let them know you're going to experience the same thing, and you would love it if they would write you little love notes, or give you hugs and kisses, or rub your feet, or whatever. Give them tasks to do to show their love for you, and that will help them feel confident and connected to you. Again, discussing with even school-age children about physical changes that you might experience, where on your body you might be affected if you need to have a surgical procedure or some kind of biopsy or something, so that they kind of are understanding this and it's not a mystery to them, will be helpful. Teens and tweens are probably the toughest group to talk to about a cancer diagnosis, because although they are still children and their brains have the coping skills of children, they also have an advanced understanding. So they're going to have the fears of an adult when they hear the word cancer, but the coping skills of a child. So for this age group, it's very important to keep in mind that they're possibly going to instantly go to a very fearful place in their mind. And they may or may not share that with you, because unlike the school-age child, they've developed more filters in place to not want to show that to you, or to maybe want to be brave. But what might come out is potentially all over the map. Kids could regress and become more clingy. So, your previously independent 13-year-old may want to be sleeping in bed with you. On the other hand, kids might become more withdrawn and more independent and more defensive, and even seem angry at you, which can seem baffling, but that's just their difficulty in coping with this. And, the idea that cancer could take you from them is going to be at the back of their mind, and they're going to have some emotional response to that, which sometimes won't seem to make a lot of sense. Both for school-age kids and for teenagers, I think it's really important to have multiple conversations over time about your diagnosis and your treatment and their feelings about it, about how it's affecting you, how it's affecting them. And probably best not to have these conversations where you're specifically saying, hey, I want to talk to you about my cancer and how you feel about it, but rather to kind of have some engaged activity that you're doing with them, whether it be cooking together or driving in the car or playing a game together, and just have it kind of come up naturally and sort of explore with them as much as they want to. Don't press it. But try to have multiple conversations. Don't expect that this is going to be one conversation where you just are like, oh, okay, I addressed that. Talked to my kid about the cancer, boom, done, never going to talk about it again. The more you can talk about it, the more you can invite cancer to be part of your life, the less scary it's going to be for all of you. And although this is obviously a challenging time in your life, and my heart goes out to you, and I am sending you all my love if this is something that you are dealing with, it doesn't necessarily have to mean that this is going to be a horrible thing for you and your family. I think if you can think about how you can make this experience of a cancer diagnosis something that positively defines you and your kids, whether that be through work together to help other families in the future going through similar diagnoses, whether that be, making gifts or a little book together to support families, or recording videos on YouTube, or helping out in a community or at a hospital when you're able to in the future, or fundraising, or providing education to others. All of these things can be positives that you take from the negative experience of having gone through cancer diagnosis and treatment. And it basically doesn't have to be this horrible negative thing. It can be something that you invite as part of your family. Invite cancer to have a seat at the table with you all. Let it be something that you all can talk with each other about, and be unified in your anger at, because you're going to have all those feelings, right? And that's okay. So I hope that this video was helpful to you. If you have any comments or thoughts, please share them with me through the website. You can email me there. Again, it's theparentdoctor.com. All right. Take care, everybody. Bye.